Peter Block for CardioSource News, and there is breaking news from the AHA concerning the STEMI guidelines. I'm here with Dr. Fred Kushner from New Orleans, Louisiana. Fred, you were the chairman of this guidelines group. Tell me what the changes are. There's obviously some new news here.
This was a focused update, and so we responded rapidly by combining the PCI and STEMI committees in the Update Bethesda-style conference to respond to these. Our new recommendations are for each community to develop a STEMI system of care that will involve the recommendations of Mission Lifeline to recommend protocols for triage and transfer for STEMI patients beginning in the emergency medical system through hospitals and through hospital transfers from non-PCI to PCI-capable hospitals. That's one major new advance. We also have advances in adjunctive therapy for STEMI patients, including the inclusion of bivalirudin and prasugrel as part of the antithrombotic regimen, the use of drug-eluting stents, and the recommendation that for both bare metal stents and drug-eluting stents in ACS patients that antiplatelet therapy continue for at least a year.
There's also some information concerning the use of FFR during PCI, isn't there, Fred?
Not during STEMI patients, but for assessment of borderline lesions, we're now recommending that FFR is a reasonable tool to use to assess the significance of intermediate lesions. We're also now elevating to a Class 2B the recommendation that under certain favorable circumstances, main left lesions may be acceptable for PCI therapy.
So exciting major changes and some modification as well, Fred. What other modifications would you like to list as perhaps the one or two most important?
I think that it's important to emphasize that for any ACS patient, we really recommend that there's continuation of dual antiplatelet therapy, including aspirin and either clopidogrel or prasugrel for a minimum of a year. I think that's an important adjustment, that bivalirudin is now acceptable in the cath lab for STEMI patients, and that in Mission Lifeline, we are really recommending now that patients may be transferred who are high risk, who are to come to non-PCI capable hospitals, are transferred early to PCI hospitals for PCI if necessary at an earlier time.
Well, those are the highlights, so if you want to come back and find all the details, just go to CardioSource and you will find them there. Thank you, Fred.
Thank you.